This is Going Under, Anesthesia Answered with Dr. Brian Schmutzler. I'm Vahid Sadrzadeh, and we are brought to you by the Butterfly Network.
I'm going to let you in on something that's completely changed the way I practice. I've been using Butterfly probes for years. It's a portable ultrasound that plugs directly into my compatible smartphone or tablet, so I can start scanning in the bedside in minutes. If you've used the older versions, or even if you're new to handheld ultrasound, let me tell you why this new IQ3 is a game changer and really impressive. First off, having an ultrasound literally that fits in my pocket allows me to move faster, whether it's vascular access, procedural guidance, or just getting real-time insights from my patients. And the tech inside this device is pretty incredible. It has biplane imaging, which lets me see short axis and long axis views at the same time, which is great for procedural guidance and also for teaching learners. The new needle out of plane preset even shifts the scan digitally so I can see the needle tip sooner, making a real difference when precision matters.
It does matter. Precision does
definitely
matter.
matters. I did like 22 blocks a day or something like that. And the image quality, honestly, the IQ3 holds up against some of the cart-based high-end systems I've used. That's impressive for something this portable. If you're looking for a device that supports your practice, I can't recommend the Butterfly IQ3 enough. And right now, they're running a special offer. You can get $750 off the latest IQ3. Check it out at butterflynetwork.com, code Brian25. We got some other codes too that we can share today, I think.
What's that?
We got the Masa
Oh,
code.
the Masa.
We got the
so
Masa
yeah,
code.
okay, I'm gonna open this up.
Yeah, do it.
Can I open this up?
Yeah, I'm looking for the Masa code.
You know how I
right
like
now.
to eat on podcasts and television. Just a specialty of mine. So Masa, big shout out to Masa
Yes,
too.
Yeah, affiliate now. We're an affiliate.
So we got 3 flavors here.
Yeah, we've done the churro before. The churro's great for like a dessert.
Here's
flavor.
is this a
Yeah.
churro? This is good anytime, honestly.
Yeah, I like the churro.
What do you have?
I have this is my favorite. A little bit of spice, the cabanero.
Cabanero.
It's like a mixture of different spicy peppers. Yeah, look at that.
Lime. All right,
Yeah.
so let's give it a
shot.
try here.
Give it a shot. Yeah. Yeah, good. Yeah. My kids keep stealing these from me, so I have to. So I've taken a bunch.
Hide them?
I've taken a bunch to work now, and I'm hiding the other ones in the basement
Nice.
behind the locked door because they keep stealing my chips.
So delicious, I have to have water.
Yes, I know. They're very crunchy. So I'll tell
And
you
addictive.
I tell you what I do with them.
Uh-huh.
I get organic salsa.
Yep.
And then I dip them in the salsa. And we do mild salsa because my kids don't like spicy stuff.
Sure.
So that's why I do the cabanero because they're spicy.
So it's Dr. Brian?
Yeah. So
Is your code?
Yeah. So that's the code. The code is Dr. Brian. The link is masachips.com/Dr. Brian. We'll put it in the link, and that gives you 20% off first time orders.
And 20% off.
20% off first time orders. Yeah.
Which is a good deal.
Yeah.
And shameless plug, link, like and subscribe.
Yeah, please.
You always want to like and
Always
subscribe.
like and subscribe. Yeah.
If you're on YouTube.
Although after today you might not. I don't know. We're going to be a little
Tell
controversial.
us a little bit more about RFK.
Yeah. Well,
listen.
She might be almost as controversial.
Well, yesterday they were talking about the correlation here is just stupid, but the correlation is yesterday was a seminal moment in the NBA.
Okay.
Key player got injured, went down.
Donovan Mitchell?
No.
Oh.
The Celtics guy.
Yeah, I'm a Pacers fan. So Donovan Mitchell getting hurt for the Cavs was great news for me when the Pacers
And they're up
destroyed them.
3-1.
But anyway, go ahead. Yeah.
Anyway, with the draft, just a big day. Seminal day in medicine, maybe in healthcare today, because a lot of chips falling.
Yep.
And that's what we're going to discuss here.
Yeah.
And if you go to your Instagram page, you can find all the latest news as well. But we're going to talk about it here on the podcast. We've been talking about UnitedHealth Group for a minute now.
Oh, yeah.
More than a minute.
Love it. I love the way things are going for UnitedHealth Group.
So what exactly went down today?
All right,
Just tell us the news.
We're going to start there and not with the Surgeon General. That's fine. We can talk about it. So there's been a bunch of stuff that's happened, right? Obviously, there was what do we call it? Unaliving of the CEO of UnitedHealth Group.
And that was back
months
when?
back.
That was like November?
Yeah, the end of November. Yeah. And sort of a lot of chips have fallen since then. So they had a hard time finding a CEO. And then last week, the first quarter earnings for UnitedHealth Group didn't exceed their planned target for the first time ever, for the first time since the company has been around. And the shareholders right after that sued UnitedHealthcare for
The
not
shareholders.
the shareholders, yes, the major shareholders sued UnitedHealthcare for not making enough money, and they said it was because they weren't denying enough claims. If that doesn't tell you everything you need to know about UnitedHealthcare and how health insurance, but all health insurance is really designed just to make money for shareholders and not provide any value to those who actually have the insurance, that's all you need to know. The shareholders sued the company because they weren't denying enough claims to make enough money.
That's all you need to know.
Yeah, that's really all you need to know. So that happens last week. So this week, the CEO resigns to spend more time with family.
Effective immediately.
Effective immediately. Yeah, basically just walks right off the job. And,
I guess he just had to dire need to spend more time with family today.
Yeah, right. Exactly. Yeah. Yeah. And then they announced that for the rest of 2025, they're not going to make any projections and not share any of their financial projection data.
Publicly traded company?
Zero.
Publicly traded company?
I don't know that if they're not going to share their actual financial data, but they're not going to share any of their projections for the rest of the year.
I don't know. I mean, we were in the airport and my buddy was like, "Do you have any United Healthcare stock?"
Yeah, get rid of it.
And I'm like,
I'm sorry. I'm not giving you financial advice. I'm not a certified financial
absolutely
planner.
not.
Yes.
I don't have any United Healthcare.
I don't know if I have it. I don't know if I have
But wait,
it in my
as a
index
publicly
funds.
traded, I am not a financial planner or advisor.
Yeah.
A publicly traded company who doesn't provide that information.
It's just the projections, though. I don't think publicly traded companies have to give projections. I think they have to give actual financial data.
What actual hope does that give you if a company
zero.
is not willing to give you projections?
Let's see what they're.
How
let's see
far
what
did
they're
the stock?
trading. Yeah,
how
let's see
far
what
did
they're
the stock
trading
drop
today.
in one day?
I don't know. See if you can get it before I can. Probably a lot. I would imagine a lot. UHC, right? No, it's not their code. I don't know what their code is.
It's UNH.
UNH, yeah.
Dropped 67 points
today, yeah. 67 points today. So if you look at the 1 month, they were at 600, over 600 in a month ago, and today they closed at 311.
Well, if you look at a week ago, they were 379,
and now they're 311. But yeah,
311.
So they're
even 3 months ago, right? So
Yeah.
April 16th is what you're looking at?
yeah.
Or April
It's April 14th.
11th. They were
Yeah.
599.
Yeah.
April 11th.
Yeah.
And today,
They've lost almost half their value. So
some would say this is a good time to buy United Healthcare.
So again, I'm not giving any financial advice
For
here,
sure.
But what I think is happening is I think the insurance industry, and we'll talk about my bold
Yeah.
predictions for 2025, 2026, or end of 2025 at the end. But I think the health insurance industry is crumbling. And I think as abhorrent as it was what the fellow did that unalived the CEO of UnitedHealthcare, I think that was the seminal event, the catalytic event that will take down the health insurance industry in the United States.
Well, it's pretty unbelievable that they said basically, CEO, you're out.
See ya. No,
Well,
he wants to spend more
sure.
time with family.
But that they weren't denying enough claims.
Yep, that was the lawsuit. They're not denying enough claims.
Just crazy to me.
Yeah.
So that was one.
Yeah, so we'll get back to that in a minute. So what I really wanted to talk about today, and it's big news, and everybody's talking about it. There's a ton of like medical influencers on social media, which are driving me crazy talking about it. But so the new Surgeon General,
Means
nominee, right?
Yep.
She hasn't gone through the Senate.
Casey Means.
Casey Means is her name. Yes, correct. So she's the new Surgeon General nominee. So what I want to do, I'm not saying I support her. I'm not saying I don't. What I'd like to do, I'd like to walk through, in my perception, the negatives she has, and in my perception, the positives she has. Okay. So let me go through the one straw man argument negative. Okay. She doesn't practice medicine. Okay.
She's a social media influencer.
Do you remember talking, and we've interviewed Dr. Jerome Adams, friend of ours, friend of mine, known him for a long time. He was the Surgeon General, not the current one, I guess, is Murthy, but the one
was the one
that.
before.
Yeah. So during COVID. So he told us that he is the only practicing Surgeon General in a long time, right? So these are
And
people
he gave us reasons why.
exactly. Yeah, you don't have the time, blah blah blah, right? There's a lot of
Don't
spend
spend time
reasons.
with family.
Right.
Don't do any of that.
There's
stuff.
a lot of reasons
Pay.
why the Surgeon General doesn't practice, which I think are legitimate reasons. He did. He said, he was, probably mid-career,
Right.
not that far ahead in his career than I am. So he was mid-career. He wanted to keep practicing. He wanted to go back to doing anesthesia when he was done being the Surgeon General. So I think it's really not a genuine argument to say, well, she doesn't practice medicine. Now, you could maybe say she never practiced medicine because she didn't finish residency. Fair. But most of the Surgeon Generals for the past 50, 60 years haven't been actively practicing medicine. Okay? So argument number 2, she gave up her medical license in Oregon because she wasn't practicing anymore.
Mm-hmm.
So she willingly withdrew her medical license. There wasn't any issue with it, right? And so let me explain a little bit. Everybody says she's not a doctor. She is a doctor. All you have to do to be a licensed physician in almost every state, finish 4 years of medical school, 1 year of residency, and pass step 3 of the boards.
And she's done those things.
She's done those things. She had an unrestricted medical license in the state of Oregon. So she's had a license in the past. There is a requirement to be Surgeon General to have a active license in some state. Okay. So I think probably she will reinstate her license. But as of right now, she cannot be Surgeon General without having an active license. And you know who posted this? Jerome actually posted, like, here's the requirements to be Surgeon General.
I saw that the other day.
Right, yeah. So I texted him. I haven't heard back. He's a busy guy. I texted Jerome. I haven't heard back from him, just saying, hey, what do you think?
Yeah.
So I would love, and Jerome, if you're listening, I don't know if you listen to our podcast or not, but if you are, I would love to have you back on the podcast and we can talk about this and you can give your
2 cents.
Yeah, give your opinion. So here's what I think is the major issue.
So you've named 2 so
So
far.
I've named 2 so far. Yeah, correct. So I'll name, let me go with one other minor issue and then I'll tell you the major issue. Another minor issue is, and it's not really fair because the AMA president is an ENT doc, right? But her training is in ENT, ear, nose, and throat, right? Surgical ENT.
Sure.
I don't know that makes you the best person to speak on big issues in medicine.
Pandemics.
Right, that sort of stuff. So she doesn't see patients like in an outpatient setting except as a pre-surgical thing. So maybe that's a negative, small negative. The big issue I have is she doesn't have any training in public health. Okay? So that is my biggest issue with her, regardless
Which,
of all
if you
the
look
other
at the
things.
past Surgeon Generals,
They all have, yeah.
they all have
They've all-
public
right.
health experience.
Because you are the director, and I can't remember, I'm going to say this way wrong. But you're basically the director of the public health core.
Yes.
Right? Of the 6,000 people, you're running a 6,000 person company. And you remember Jerome talked about that at the Butterfly Conference. So there's that. But also, you're dealing with a lot of infectious disease. You're dealing with endemic stuff, maybe epidemics and then even pandemics, as we saw with COVID. So now, to be fair, if she appoints a very good deputy Surgeon General who's got a ton of experience, I mean, and I can't remember, Erica, I think was her name. I don't remember her last name. Schwartz, Dr. Schwartz, right? Was Jerome's deputy Surgeon General. I wonder if she'd come back because she has a ton of public health experience too. So I think you could probably overcome that if you had a good deputy Surgeon General. But I think that's her biggest negative. In my opinion, her biggest negative is the fact that she has 0 public health experience.
I mean, looking at it from the outside in, again, you're a practicing physician.
Correct, yep.
Looking at it from a lay perspective, I think that's a lot of negatives, right?
It
It's
is.
a lot of things that add up on this side of the column, right?
Correct.
If you're going at the plus and minuses,
Correct.
those are some minuses,
There
right?
are. There's some big minuses. But there are some pluses, right? So I don't think that anybody in the United States can agree that our current healthcare system and even public health is really working, right? I mean, can you really say like, oh yeah, we have great nutrition, we have great exercise, we have great, food, we have great medicine in the United States. I mean, even Jerome says we have a sick care system, not a healthcare system, right? So I don't know that you can argue what we're doing is working. And she has a different approach. She's similar to, and I'm going to say it, RFK Jr. when it comes to nutrition, exercise, Let's not have a bunch of additives in our food. Let's not, do things like put a bunch of pesticides on our crops, right? Let's do common sense things to try to make sure that we're not poisoning ourselves via food. I mean, you're even talking about like the makeup and aesthetic industry, right? Like I've switched to deodorants that don't have aluminum in them because there's a lot of data out there now that talks about how bad aluminum is, right? And whether that's true or not, if I have an alternative, I'm going to use the alternative. I believe in functional medicine, right? You saw my post.
Eastern medicine.
Yeah, you saw my post yesterday. I'm certified in acupuncture. I believe in supplements. Here there's certain ones that are better than others, and there's certain that are made better than others. But I believe in functional medicine as an additive to traditional medicine, right? But I don't think either one's got it 100% figured out.
I don't want to push back, but I do want to ask.
Yeah.
What makes her qualified? You listed all these things, which is great.
Yeah.
Our public health system is crippling, right now.
Yep.
I mean, it's really at a breaking point.
Yeah.
Like we've seen.
Yeah.
What makes her individually qualified to make a judgment call? Let's say another pandemic happens.
Yeah.
Let's say something comes down the pipeline. Mm-hmm. Who's to say it's not going to over the next 3 years? What makes her qualified that she's going to make the right decision based on if those things happen?
The people around her, right? I don't think she individually is qualified to make most of the
But then why would they nominate her is my question.
Because she's a contrarian, right? Just like, again, RFK Jr. is a contrarian, right? We've been doing the same thing for the last 100 years. Maybe it's time we take a different path and see if that works, right? So that's number one. But number two, and I'm just going to put it out there, she's not bought and paid for by the USDA, the FDA, all these company or all these. So
she's an outsider, just
like our current president, correct? Right. So I think she's not going to kowtow to the USDA. She's not going to kowtow to the FDA, who approve things through the USDA, through the FDA, through all of these things that shouldn't necessarily be approved. I mean, I think that we have a corruption issue in our healthcare system. We have a corruption issue in our government related to healthcare, food, exercise. I mean, you had the AHA. Did we talk about this at all? I don't think so. So the state of Texas was trying to ban basically processed high sugar foods in SNAP, the like food stamps program in Texas. And the AHA sent a lobbyist to defend not doing that, claiming that there's no evidence that high sugar and processed foods cause heart disease. You know who's the biggest, and I've heard this before, and I don't know if it's 100% true, but you know who's one of the biggest supporters of the American Diabetic Association? Cadbury, the chocolate company, right?
It's kind of laughable.
It's crazy, right? So
it's kind of laughable.
So I do like that she is outside of that influence, right? She doesn't care. Now she's got other things, right? She owns her own company. She's got other influences, right? But at least it's not the same influences that we've had for the past 100 years. So I'm not making a judgment whether she's a good pick or not, but I think that it's a little bit ridiculous that 90% of the medical community on social media, at least, and even if you watch the news, a lot of the medical community say, well, she's not qualified because of this, and they don't talk about any of the positives that she might have.
Well, of course they won't.
Well, yeah.
You know what I mean? I mean, if you're, and that's just knowing the television industry.
Well, but what about social media? That you would think on social media you would have some percentage of physicians who would take at least a measured approach, if not.
But how do you know? I'm just going to say it. How do you know that those social media channels are not paid for?
That's true. You don't know.
How do you know that those social media channels or influencers or whoever, they are not bought and paid for?
You don't.
So that's where I'm coming from, is you have plenty of people out there on social media, plenty of people out there that are influencers, that are whatever. They're just
bought and paid for by somebody.
100%.
Well, I think there was a big conversation about that during COVID, that a bunch of influencers were paid to go out and say, get your vaccines and stuff. So, I mean, I guess that's possible. But a lot of these people I watch, like I tend to watch these people who are kind of emerging in the medical field, and so they have the 5 to 10,000 followers. I can't imagine that those people are like bought and paid for. And all of them are saying the same thing. So I just don't understand why we're so biased one direction. But
yeah, I mean, I think that's just how our country is right now.
Yeah.
I mean, I think our country is very divided. You're seeing it politically.
But it's not it's not just division. It's one-sided on social media. Like, I'll be considered, again, I think this is going to be controversial.
Yeah.
I'll be considered way to the other side.
An outlier.
Just for saying that she has some positives and negatives.
I mean, we've already seen the backlash of you saying the magic words.
I can't even imagine if somebody said, hey, I'm really for this person as Surgeon General. Wow.
And I think I think this is what I've really enjoyed about our podcast, what I've really enjoyed about talking to you about these issues, is that we're all about, and you are all about the education piece of it.
Yeah.
So whether you vote this way, that way, or the other way, whether you believe in, RFK is the most terrible person on the face of the earth, or that UnitedHealth is this, that, or the other thing, you're getting information, right?
Right.
You're learning something.
And I welcome the debate. Let people say
100%.
stuff, and I'd be happy to talk to you 100%. About it. Right? So there's a couple other things that she talks about that I really want to get into. So obviously, big pharma is a big thing, big medicine, blah, blah, blah. So she does talk a little bit about vaccines. We'll go back to vaccines. And so, again, vaccinate your kids. But there are a couple things that happen when a baby is born. And honestly, Peter Attia's talked about this too. And I can't imagine there's very many people out there who are not Peter Attia fans, right? Like, he's all about, he's a surgeon. He still does surgery, right? He's a traditional medicine guy, but he talks about how do you keep yourself healthy? How do you stay healthy as you age? But he even says, why are we giving babies, right, when they're born? And you and I talked about this when you had your baby. Why are you putting cream in their eyes it's erythromycin cream for chlamydia, which you test the mom for, right? I have less of a problem with that than I do the hepatitis B vaccine in a baby who's just born. You test the mom. Very few people now actually have hepatitis B unless you are having a lot of unprotected sex or you are an IV drug user, right? And then there's some nurses from way back when who got hepatitis B when it was more prevalent.
Yeah.
So I don't understand why we're doing that as a baby. Now I understand, maybe you do that later on if there's a lifestyle issue or whatever, but every single baby that is born gets the cream and gets the hepatitis B shot. I don't understand that, and neither does Peter Attia. And I would say that, and Zane talked about this too, it's creating an entire industry of vaccines, which, again, I have a problem with. I don't have a problem with the vaccines, just like Zane said. And everybody who gave him a hard time, I want to put them down for giving him a hard time. He said, yeah, vaccines work. Vaccines are a good thing. But highly incentivizing companies to make a lot of money off of vaccines with no repercussions is a bad thing. So she talks about that. Then she also talks about how our healthcare, or how our medical education system is broken. So that's something I definitely want to get into. And I'll just do it in brief, but our medical education system, and she talks about it, and it's true. I mean, I trained, 15, 17, 20 years ago, or I started medical school, I guess, 21 years ago. We got zero education on nutrition. Zero. Mm-hmm. I had not a single lecture on nutrition, right?
Which is nuts to me.
As a physician, I have zero education on nutrition. Really?
And that's just up to you to get that education?
Yeah, I guess you
by
learn
yourself?
Or you talk to a dietitian or something. I mean, I don't know. I don't know how you get that education, but I had zero lectures on nutrition. And again...
Do they now?
I mean, I don't know. I haven't been in medical school in a long time, but I would say that the majority, at least the last quote or the last statistic she quoted was that 80% of medical schools have zero nutritional education.
Interesting.
And so the medical education system is built for test taking, not for actual, procedural ability or ability to treat patients and that sort of stuff. And then there's all kinds of big stuff coming out now. Like, I can't remember, I think it was UCLA. Did you see this article? UCLA Medical School, like 60% of their students couldn't pass the boards. Like, I So you've got a system that's designed basically for people to take tests.
We were just talking about that actually.
Were you?
At the conference, we were just talking about how they make the boards every 2 years like passable, but not impossible.
Right.
Because
you don't want people not to be doctors.
You can't, right. Otherwise, you have no doctors out there.
Right.
But 60%.
Yeah, it was something crazy. I will have to find the article and link it or something.
Yeah.
But our medical education system is also built on making money for hospitals, right? So medical students aren't as valuable as residents, but medical students still do a lot of things that are unpaid, right? We're paying to go to medical school, and then we're doing a lot of things. There's some learning in there, probably more so in medical school. In residency, you're just cheap labor. So for those people who don't understand how residency works, so you're a full-fledged physician, right? You could write orders, you can take care of patients. You've got to have a attending sign off, but you essentially have free reign to take care of patients. And so especially in procedural specialties and like anesthesia, you could have one attending covering 2 residents. And the hospital so not only does the hospital not pay anything for that, right? Because the CMS pays for that. They also get 100% indirect costs. And we talked about this with the NIH. So if let's just make a round number, and I don't know what residents get paid now. Let's say that the resident gets paid $50,000 with all in with benefits and everything. The hospital receives $50,000 cash for teaching that resident. So residents are just cheap labor, and a lot of us worked. I mean, I won't say I ever worked over 80 hours. Crossing my fingers, but there's work rules now where you can't work more than 80 hours. But if you think for $50,000 a year, you're working 80 hours a week plus 50 weeks a year, it breaks down to like $2 an hour. So we are the cheapest possible labor.
Which it probably tends to be more than 100 hours a week.
I'm not saying that. I'm not. I would never say that I broke.
No, I'm not saying
hours.
You in specific or specifically. Yeah. I'm just saying from the outside looking in, 80 hours is...
So some of that is necessary in learning, right? If you want to see a disease process all the way through, you might have to spend 25, 30 hours straight with a patient, okay? That might have to happen. The problem is that most residents are not being put in cases or taking care of patients strictly for the learning. Mm-hmm. They're there to take care of the patient and generate revenue at a low cost. So I might be doing appendectomies all night long as a resident. Is there much learning experience for that for me? No. Put the patient to sleep, put a tube in, sit there, wake them up. Like that. So now if it's a big open heart case or AAA, meaning a abdominal aortic aneurysm rupture, like those are cases you learn a lot from. Just your standard over and over again appendectomy cases. It's just cheap labor, which is something she talks about. Like she was disillusioned with the medical education system, and I think I was as well. So
let's just review the pluses and minuses.
Okay, sure.
So you said the negatives for Casey Means.
So probably the 2 biggest negatives are I think that she hasn't taken care of patients in a office primary care setting to see how patients really are, right? She's a surgeon. And I think the main issue is she doesn't have public health experience. That's personally, that's my biggest issue when I'm evaluating somebody for the Surgeon General role. That's kind of like criteria number 1 for me is like, because you're dealing with all of the infectious disease. So what is your public health experience? So that's the biggest negative. Positives for me, like I said, she's not bought and paid for by any of these big pharma, big ag, all that kind of stuff. So it's a different direction. She's a contrarian. She's opposite of everybody else. And I think she's got really good ideas on nutrition, health, wellness, all that sort of stuff.
So what's your big predictions here?
All right.
I want to know. We've been skirting around this issue for 19 episodes.
Yep.
So what?
Okay.
And we've asked everybody that's on the show.
So I've got, I don't know, 5 or 6. Okay. So one of the things is already starting to happen is that the health insurance industry, I don't know that it'll totally collapse in 2025, but I think it'll start to collapse in 2025. And the health insurance industry has a couple of things it can do. It can either shut down, say, hey, we're not making enough money, we're done. Medicare, you figure it out or whatever. Or it can adapt and say, we're going to change the way that we pay providers. We're going to change the way that we, report profits. We're going to change the way that our shareholders, experience, gaining money from us and all that sort of stuff, and turn it into. So I have no problem with companies making profit. I have a problem with companies making profit off of denying care to people or, doing things that are very clearly unethical, right? So they'll either adapt or they'll go out of business. And there's going to be legislative stuff going on too. I guarantee it's a big hot button issue now. I guarantee there's going to be laws passed or some sort of legislative fight against the health insurance companies.
How many of your peers feel this way? How many doctors, how many physicians around the country are...
I mean, everybody hates health insurance because their whole goal is to deny your care, as we've seen, right? So nobody likes health insurance companies. There are some better, some worse. I mean, I think some of the local HMOs, PPOs, all that sort of stuff, I think those are maybe better. But I mean, the other problem is these health insurance industries are now the companies that take all the Medicare stuff, right? So since the ACA, since Obamacare, they handle all of the processing for these Medicare supplement plans, Medicare Advantage plans, Obamacare, all this stuff. So now the government's feeding them money too. Mm-hmm. So they're interwoven in all of it. So it's going to be messy. I think it's going to be ugly. I personally would not buy any stock in any of these companies until they show some sort of forward-thinking way to change what they're doing. So I think that's one of the big things that's going to happen. And I wrote this before all the stuff that's happened with. I mean, I sent this to you
you did.
Over a week ago,
yeah, you
right?
Did.
Before all this stuff happened with UnitedHealth Group. So that's number one. I think that the current administration is going to legislate against big agriculture, big food, and big pharma. You've already seen it, right? The Trump administration has already basically told the pharmaceutical companies, you can't charge more for your pharmaceuticals in the United States than you do in other countries. And so, that's a step towards that. But I think there's going to be a ton of legislation against all this kind of stuff. And that's partly because of who's our HHS secretary, partly because of who's our president, but also partly because all of this is now in the public eye. This is a public discourse now, right? There's people talking about this, like talk show hosts and TV hosts, not just on the right, who are talking about how awful a lot of this stuff is. So that's number two. Well, I said the pharma thing. That was number three. Drug prices. Again, I wrote this a week and a half ago. Drug prices will be negotiated with big pharma. Well, there we go.
Yep.
Look at that. All right. So our other least favorite, private equity. Okay. Mm-hmm. So this is happening in a lot of states already, but I think there's probably going to be a push towards a federal ban on private equity owning medical practices, basically, yeah, and hospitals too.
You're not saying this is happening. You're just saying you're making a prediction that this is going to happen.
There are a lot of states that are working towards that. The problem is it's really hard to write laws, and I'm not an attorney or a legislator, but it's really hard to write laws that are directed right at private equity and venture capital and don't. So there was a proposed law in the state of Indiana that would require the attorney general to approve any merger of any kind, any size, between any medical practices. So who does that screw over? Well, that doesn't really screw over private equity because they're going to spend a lot of money and get it done anyway. It screws over the little guys, right? So if you've got a company of 5 providers and I've got one of 5 and we say, hey, let's join, I got to go get the approval of the attorney general. That doesn't make sense. Right. But it makes sense if you try to keep private equity and venture capital out. So I think they're going to get more sophisticated in how they do that. But there's a big push in a lot of states already to get private equity and venture capital out. And then this is going to be super unpopular.
This is 5.
Yeah. And I think there's one more, but so this would be super unpopular, but I think there's going to be a lot of government pushback on not-for-profit hospitals. I think the government's going to come after them. I honestly, a lot of these not-for-profits, because of the way they're set up, and I've seen some of the inner workings of these, they're really not-for-profit. Just like big schools like Harvard and Yale are not-for-profit. They just take that money and give big bonuses and build buildings and all that sort of stuff, right? So I think the government's going to come down because hospitals are, a lot of them, not all of them, a lot of them are super egregious in the way that they charge and treat patients.
You saw that breaking news thing that came down today about $450 million, the federal grant for Harvard.
Oh yeah, that they pulled.
Yeah.
I mean, so that's a whole nother, that's not,
besides the point. I'm just saying
that's not in my expertise at all. But I do have a lot of involvement with hospitals, and I have a huge problem with the way the hospitals treat patients. All right, my final big thing.
Okay.
So I think because of this whole issue with the healthcare industry, I think that misguided legislators will try to come after physicians, physician compensation, which we talked about before, physician autonomy, all that sort of stuff. What I hope and what I think will happen is that not only the medical community, but the community as a whole, because I think we're not great, but we're okay at showing our value, will backlash. There'll be a backlash against the government coming after physicians that way. I mean, you've already seen that. Again, you've seen that on social media where people are like, doctors make too much money. It's like, come on, 10 years plus of additional education, 80 plus hours a week, right? So I think if they try to do that, which I do think they'll do, there'll be a big backlash from the community as a whole, trying to lump physicians and other providers in with private equity, hospitals, health insurance companies.
You know what America just wants?
What?
To be healthy.
Yeah, I think so. Yeah.
I mean, honestly, right? I mean, and viewing this from the outside is just really interesting because as you guys are internally battling,
right,
and the government is stepping in and push and pull, it's like, we're like, okay, why can't just everybody get along so we can have good health care?
Well, there's no
you know what I mean?
money in being healthy. There's money
100%.
in being infinitely sick.
Correct.
Right?
100%.
For everyone, right? Including physicians. Now, I don't think any physician is out like, oh yeah, I want to make sure that I have plenty of sick people that I can take care of, right? But I do think that businesses like private equity, like venture capital, like hospitals, like pharma, like the USDA, like big healthcare in general are out there saying, how do we keep people sick so we have customers?
You know what's going to change everything?
What?
AI and robots.
Potentially. There was just an article in China.
After this conference this past weekend, I saw it from my own two eyes.
Oh, yeah.
Everything.
Tell me about the conference.
It was good. It was the
Surgeon?
colorectal. Yeah, Surgeon. Our shout out to our guys over there. And if you do, I will say this. I'm going to link it below. If you would like to see the conversation you had with this former Surgeon General.
Two parts
with Jerome Adams, Dr. Jerome Adams. I'm going to link it below because you should check it out. Very fascinating 2-part conversation with the former Surgeon General. Very well, but it's you and Ankit and Dr. Dr. Ankit Patel, Dr. Jeremy Hefner on that podcast, and really fascinating stuff.
So what about the AI?
So this is the American Conference of Colorectal Society, whatever, celebrating 125 years, oldest conference by society, medical society in the United States. That's maybe impressive. The world, but I'm going to say the United States for sure.
That's impressive.
Was able to be there for a lot of conversations around what are you seeing specifically in colorectal cancer surgery, all of that stuff. But seeing these different booths set up, 2,500 medical providers.
Wow.
There in San Diego this past weekend. There wasn't a booth went to
without AI.
Without robot technology, think 25 years ago.
Oh, yeah. Our first robot we had, I was probably, we probably didn't get one until I was in residency that I knew of. And at that time it was taken, so they were doing robots primarily for prostate cancer. And it would take them, 6-7 hours. Now those guys do those cases in half an hour.
Yeah.
45 minutes.
It's crazy. I mean, and surgeons we know use robot technology, AI, whatever. I just think that's going to be the way of it. And it's going to be really interesting to see how every one of the groups that you mentioned responds to that technology. It's almost like a race.
Ask ChatGPT. What's the best way for me to be the healthiest I can be?
Hey Siri, what's the best way for us to be healthy?
Okay, I found this on the web for what's the best way for us to be healthy. Check it out.
Oh, it won't tell us.
It's just tips, UCF, 8 tips, base your meals on higher fiber, that sort of thing. But I just think it's going to be really, really interesting to see how not only the medical community, physicians and doctors adapt. It's going to be really interesting to see how healthcare companies adapt and implement.
Yep.
It's going to be really interesting to see how
Hospitals,
pharma, about private equity, all of these. It just seems like an arms race to the top of the AI food chain right now.
Maybe.
That's what it seems to me.
Yeah.
And take it or leave it, for the good, for the bad, for whatever. It just seems like money is at the center of all of this.
Always is, right?
Always is.
What?
And
Money's the answer. What's the question? You never heard that before?
no, it's good.
Yeah.
It's good.
Yeah.
And I just think it's going to be really, for me as a lay person on the outside, it's just really interesting to see all this, because we're just here peering in saying, okay, well, I just want my surgery to be approved.
Yeah. Yep.
When we know 90% of the time it's not going to be.
Right.
Or, we want this approved. We want to be, healthy, but we know that there are other things going on. But it's really interesting because I think AI is going to be front and center in every decision we make in 2025.
Did you see the hospital in China that's all robot? Did you see that?
It's crazy.
It's nuts. Yeah.
Yeah, you sent that to me last week. I'm like, okay.
Yeah.
It's just nuts. I mean, this is it. This is the way of the world. So, yes, I will link the podcast below. Is there anything else? We have one more podcast left. Is there anything else for the good of the order for today?
I don't think so. I think we've gone through a lot. I think, I think we're going to do Dr. Adam CN on our last pod for the season, and then we'll take the summer off and then come back in the fall. And I'd like to ask him what he sees as his groundbreaking, big predictions for the rest of 2025. And then we'll come back and hopefully I'm right on most of these.
I'm sure you will be.
Nah, we'll see.
Dr. Schmutzler is always right.
Yeah, oh, come on.
Masa, huge shout out. Use Dr. Brian.
Dr. Brian, yep.
And I'll link that below. Yeah. And also a big shout out to our sponsor for this year's podcast, Butterfly Network. Hey, there it is, the IQ3.
The IQ3 in my hard case.
And you have Brian 25 on that one.
Brian 25, yep.
Awesome.
Yeah.
Dr. Brian Schmutzler. Fun as always, my friend. Controversial as always.
It was a good one.
It was a good one. And we'll see you in the next one. This is Going Under Anesthesia Answered with Dr. Brian Schmutzler. I'm Vahid Sadrzadeh. We'll see you next week.